we all struggle in general with just how we feel mentally on a day-to-day basis.
Well, Hippocrates said 2,000 years ago that all illness starts in the gut. Well, we're an overburdened society. I know, at least for me, it's always been a competitive world for me.
I swelled up and I ended up, it took a whole entire year, but I did lose 83 pounds. But here was the interesting thing, is that the discipline for me paid off. What's the process where you start to see some change when you're making some of these life changes?
Well, alcohol destroys brain cells.
Okay.
And if you want to get really deep into it, look at Dr. Daniel Amen. He said you should never have one drink. So I've been taking my brain health a lot more seriously lately. And one of the things I said, you know what, I don't need to drink. So I don't drink very much.
I was disciplined to lose that weight, but man, I fall short. I do. And I get what you're saying because it really is hard to be on all the time. But at the same time, I got to think of the bigger picture. And I think everybody else has to think of the bigger picture. And I think that's what you're saying. It's really hard for those to but correct me if I'm wrong, but you're just saying that you just have to start somewhere. Welcome back to the show. Today, I am excited to have my very special guest here, Dr. Hugh Beatty. But what we're going to talk about today is we've talked a lot about the subconscious mind. We've talked about overall health, but today we're going to talk about gut brain health. Yes, that's what I'm saying. Gut brain health and how it's associated and why it's important for you to listen to what this man has to say. This man's been a doctor for a number of years. For over 10 years, has switched over to functional medicine and has made a dramatic change just recently in the last year to really focus on doing more of that, switching his whole entire practice to concierge medicine. And not to mention, has just written this book and it's published, 5 Pillars of Health, and we're going to dive into it. So, Dr. Beatty, welcome to the show.
Thanks for having me. I appreciate it.
So I think a lot of people, don't really associate your stomach with your head, right? I mean, it's like, okay, so are you telling me that our gut has a direct correlation on how we think, how we feel, how we just interact with people? And I think it's really interesting for me, as a man in his 40s, to really give this consideration because I think that we all struggle in general with just how we feel mentally on a day-to-day basis.
Totally agree. Well, Hippocrates said 2,000 years ago that all illness starts in the gut. And that's even mental illness. There's so many studies that show you that gut health is related to psychological issues like bipolarism and schizophrenia and things like that. Gut inflammation affects brain inflammation, and people don't realize that. So there's a strong connection between the gut and the brain. In fact, the longest nerve in the body is the vagus nerve. Where does it go from? From the gut to the brain. So those things are all essential.
Yeah, I hear a lot about that, the vagus nerve. Let's kind of dive into that a little bit because a lot of people talk about it. So when people are anxiety-filled or they're feeling really uneasy, they really talk about massaging or just kind of stimulating the vagus nerve. So what is that all about?
Well, it's the parasympathetic system because what happens when we're stressed out, we get locked into a sympathetic tone. And that's shown up by the fact that your heart rate doesn't variable anymore. So we talk about heart rate variability. So if you get up in the morning, your heart rate is 60, and then sometime during the day it's 70 or 80, that's a good sign. But if you're constantly at 80, go to sleep at night, it's 80. Wake up in the middle of the day, it's 80. Middle of the day, it's 80. And so if it's always 80 and there's not much variability, that means you have a high sympathetic tone. And that high sympathetic tone is most likely related to chronic stress. And that chronic stress starts impacting your hormones. So it's a catch-22 that's in a negative cycle, and it's not good for your health.
So pretty much what you're saying is that the way I'm understanding it is that this is all connected, and it's almost like you kind of go in this cycle, and as you continue on, the worse and worse and worse it gets, and the end result is stress, which leads to a lot of health issues, and obviously, we want to do a better job of being able to function, in a society for our families, for our businesses, right? Just to be overall productive. But if we're stressed out all the time, that's really difficult. So where do you think a lot of this stuff comes from? When we talk about the gut and, the brain health, I mean, obviously, it probably has to do with food and
Yes.
just some other things that you're dealing with.
Yes. Well, it's all interrelated. Food definitely impacts your gut, but stress does too. Because understand that especially for women, progesterone and estrogen is very critical for their gut health and their immune system. So if they're under a lot of stress, they suppress progesterone. Now they're more prone to gut-related issues. And one of them is you're more prone to what we call irritable bowel syndrome, but 75% of irritable bowel syndrome is small intestinal bacterial overgrowth. And I see these women a lot, especially in their perimenopausal years, 35 to 50. I get their hormones straightened out. Now their gut issues show up, the bloat, the gas, the indigestion, the constipation, the diarrhea. They go to their physician. The physician, what does he do? He calls it irritable bowel syndrome, and then he wants to put them on something that can impact how they think and their brain and their anxiety. They might give them Buspar. They might even give them benzodiazepines. They'll give them some, maybe even antidepressants, when the true thing they need is they've got to deal with the reason for their chronic stress. And I tell people all the time, a functional medicine doctor is a why doctor, not a what doctor.
Okay.
Medical doctors tell you what's wrong. You got diabetes, you got hypertension. But functional medicine doctors tell you why you have it.
Okay.
Why do you have this lack of heart rate variability? Why do you have these gut symptoms? That's more critical than what it is. It's more critical than why it is.
Well, that's interesting because I think philosophically, I think you're really kind of just defining how the approach is kind of done, right? Generally speaking. And like I said, you had a practice, a very successful practice, and you chose to change that practice because I think in previous conversations, we talked about how passionate you are about the why.
Oh, yeah.
Because if you understand the why, then I guess you can understand the what and how to deal with that.
Yeah. The what is easy to kind of, that's what diagnosis is all about. Patient presents to you, you have issues and problems, he tells you your story, and then you make a diagnosis. So if someone comes to me and they say, hey, doc, I'm having a lot of abdominal pain. Well, abdominal pain is just a symptom, but what's causing it? It could be a myriad causes of abdominal pain, but some things are more common than others. So you work the patient up. And then when you narrow it down, let's say, for instance, you say that they have irritable bowel syndrome or you have a SIBO, what we just talked about. But why do they have SIBO? What caused that SIBO? Then I start addressing the fact of what your diet is like. Have you been on proton pump inhibitors like Prilosec, omeprazole? Also, have you taken a lot of antibiotics? Why are you taking antibiotics all the time? Do you drink alcohol? All these things can increase your risk of SIBO. Stress can do it. And so then you have to deal with the underlying cause, because if you don't, you won't treat it effectively.
What is it like? So I think we're all in a hurry. Okay. I can tell you that I always feel like I don't have enough time in the day. And I know a lot of men and women, probably feel that way. I mean, even at a young age, I feel like our culture is go, 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 do. And then pretty soon, you're running out and people are getting burnt out, or, they're having a bunch of health issues later in life, or even in some cases early on. And you're like, man, you're way too young to be having this kind of stuff. So where is this all coming from? I mean, I know there's probably a myriad of things, but if you could say maybe here's a few things that I'm really seeing a lot of that are really kind of driving these kind of outcomes of why people are feeling this way and the type of health, position that they're in right now.
Well, we're an overburdened society. I mean, from the time I know, at least for me, it's always been a competitive world for me.
Right.
Because I've always wanted to do well in school. And then when I decided I wanted to go to college and then change my emphasis to medical school, it's just been compete. Even now it's competition. I'm finally in my career where I feel I'm not competing because I stepped so far away from traditional medicine that I'm only trying to focus on those who want to be well. So the second part, actually the title is 5 Pillars of Health. Do you want to be well? So I am there for those who want to be healthy. When they finally get sick and tired of being sick and tired, they're perfect for me. So we have a society that's overwhelmed. And that society that's overwhelmed, you can tell they're overwhelmed by the fact that you look at their cortisol levels.
Right.
And cortisol comes from cholesterol. So a lot of young people have high cholesterol because they're stressed out. And once they're stressed out, it starts impacting all their other hormones. Like what you had mentioned to me earlier, why are so many people are on testosterone that are men in their 20s?
Yes.
It's all related. Cortisol opposes testosterone. It not only opposes its release, but it also it it counteracts what testosterone is doing. So if a person is stressed out, the testosterone is not going to work the same, and it's going to suppress its release, and that's what the problem is. So then here's this person who's stressed out. He has high cholesterol. The doctor's not checking his cortisol level. He checks his hormones because he's saying he's also fatigued. Your testosterone levels are low. And what does he do? Let's treat it. But what's the cause of all this? It could be stress, but you can have low testosterone also because you're obese. You can have it because of elevated prolactin levels. You might have a pituitary tumor. There's other things. There's secondary causes of low T in young men. Primary cause of low T is just that you got old. There's something called andropause. Men over 45, it's not unusual for them to have low testosterone. But a man in his 20s having low testosterone, you really need to look for the cause.
Well, there was a study that came out that at least 4 out of 10 men below the age of 40 were below optimal levels. And I'm sure some of that is subjective, but let's like kind of really drill it down because I don't know, but I kind of feel like, there's a lot of contributing factors. I did a episode these last couple of times talking about, the foods, but also like the environmental, man, like, microplastics, I know has been kind of tied, right?
Endocrine disruptors.
Yeah. And it's hard because I think we are a society of convenience.
Oh, yeah.
So it's almost like we got to work at so many things. And now we got to work on making sure that, we're going out of our way to try to avoid these things. We're not going to get rid of 100% of this environmental stuff, but it is really difficult to really think about having to just try to navigate. I mean, even some of the soaps and, I've done some research on, the shampoos and the deodorants we wear.
Right.
They're working against us.
Yeah, and that's why you said the key word, work. You have to put work in order to be well. And so I tell people all the time, what separates a medical doctor, a traditional doctor, from a functional medicine doctor who seeks to do wellness is the work that the patient is willing to do. Because as a medical doctor, I tell the patient, look, you have diagnosis of diabetes, here's your med. But as a functional medicine doctor, I say, look, you have diabetes, but this is what's causing it. You have insulin resistance. How do we overcome that? You need to take certain supplements and minerals. You're going to have to hit the gym. You might have to take this herb berberine. You're going to have to drink more water. You have to get proper sleep, control your stress, all these different things I'm telling them to do. But you can actually treat insulin resistance, and you can reverse it, and you can get rid of the diabetes. So now you have to have a patient who's motivated to put in the work. I tell them all the time, I can't eat for you, I can't sleep for you, and I can't work out for you. If you're willing to do that, then you have a great chance of being well, because 98% of all illness is inflammatory. If it's inflammatory, that means we have a choice.
So inflammatory. So maybe kind of break that down a little bit, because, I mean, we hear that all the time, and sometimes I think I know what something means, but it might be helpful to kind of have it, broken down by an expert like yourself.
Well, inflammatory, there's certain blood markers you can look for. Okay. The main one is CRP. You probably heard of it, C-reactive protein. That's a blood marker I look at all the time, and there's a range it should be. There's also other ones like TNF-alpha and IL-6 are also inflammatory markers. But beyond that, there's some indirect measures of it too. Like you can look at cholesterol levels. Cholesterol levels rise based on inflammation because the body is trying to deal with the inflammation. People don't realize that cholesterol is actually an anti-inflammatory. So the more inflamed you are, the higher the cholesterol is going to be.
Interesting.
And so it's a powerful anti-inflammatory. In fact, it makes all the other anti-inflammatories. It even makes vitamin D that we talk a lot about. It makes the progesterone, it makes testosterone, estrogen. Those are anti-inflammatories. So that's one way of looking at it. It used to be said that cholesterol levels were an indirect measure of thyroid disease too, that cholesterol can rise in hypothyroidism. And why is that? Because a person who is stressed out has to have high cholesterol. And it's a link between cortisol and thyroid. The more stressed you are, the greater the demand on your thyroid gland to produce and release more thyroid hormone. And when you do that, if you don't keep up with the minerals and the nutrients, what's going to happen to your thyroid hormone? It's going to become deficient. Okay. A lot of these hypothyroid patients, not always Hashimoto's, some of it is just mineral and nutrient deficiency, especially when they're young. That's why it's a higher incidence of hypothyroidism in women than men, because women have babies and they get nutrient depleted during that time. And if they don't replete it, then guess what happens? They end up on thyroid meds like Synthroid and levothyroxine. So there's a link between cholesterol and cortisol and thyroid.
It seems like when I'm listening to you talk about that, it seems like non-functional medicine in the traditional sense I hear a lot of, pharmaceuticals that you're throwing out there.
Right.
And that is probably the way that most people deal with it.
Mm-hmm.
And I think from a society, from a cultural standpoint, maybe it's just easy to take a pill, but what you're saying is, hey, you take that pill, then, potentially, right, there's other ways to address these type of issues, if you want to go that way. So I'm just curious, like, I think a lot of people probably have been thinking about health more so lately. I mean, we've been hearing a lot of stuff, just overall about, the obesity rates, people being more sedentary, just even this new exposure to, even just social media and the interaction. I mean, it's not even just like, I remember everybody was like talking about couch potatoes and just watching television, right? That was kind of like the worst thing. Now you have a device like everywhere, right in front of your face. And I know that too much of anything that's not in moderation is probably not good, right? Because it causes problems.
Right. One of the things I really been focused on lately, as you're talking about social media, is and our devices, iPads and phones and computer screens, is all the blue light that is coming, especially for children. That blue light is very inflaming to a child's brain. And we started off initially talking about brain health and gut health, things like that. And that's what I get really concerned with. And the other thing I learned recently, probably about 6-7 months ago, because I started having some retinal type illnesses. You start getting retinal diseases when you get older, okay?
Okay.
There's a lot of different ones. We could talk about that one day if you want.
Yeah.
But my physician did not have very many answers for me. Like, doc, it's just a process. You're getting older. And I'm always looking at, okay, I know what I have, but why do I have it, and what can I do to try to slow it down or reverse it? And so one of the things I started looking at was red light therapy, because red light therapy can help. But what is red light opposing? Blue light. Blue light lowers melatonin. Red light raises melatonin. Blue light is inflaming to the retina, and the retina requires 20% of the energy that the brain consumes. So the retina needs a lot of energy. Well, red light therapy gives the energy. Blue light is inflaming. Do you see where I'm going with this?
Oh, I see.
And so then then you go down a rabbit hole. So you said these kids are coming out of the womb with their devices right at their face like that.
Right.
And I'm like, wow. I didn't grow up like that. I'm much older than you.
Yeah.
I didn't start dealing with these devices until in the mid-90s. These kids are coming out of the womb dealing with this stuff.
Right.
And the parents, and then they have thinner skulls, and so all that is penetrating right into the brain while it's trying to develop. So I'm concerned about that.
That's interesting you say that, because, when we talk about gut and brain, it probably works in the reverse too, right?
Yeah,
so,
it does.
So what you're saying is that if I'm understanding you correctly, you're saying that, hey, stuff that happens into your brain, if you're talking about this blue light exposure, right, the screens, it's going to affect your gut and cause inflammation.
Yes.
Am I correct on that?
You're
so
totally
to work
correct
in the
on that.
reverse.
And the problem is that we talked about toxin exposure for a minute already with the endocrine disruptors and the forever chemicals and like that. But there's toxins of EMF. And that EMF impacts our mitochondria. I don't really go into that in this book, but the next book I'm writing, I will go into that, all the different things that impact our mitochondria, because that's the source of energy for our body. And when we don't have enough energy, we get inflamed. And I mentioned inflammation leads to all illness. Which ones it doesn't lead to? Congenital illnesses, birth defects, but everything else. You can have a congenital illness and still get inflamed. I have patients who suffer with mental disabilities, but they still get the diabetes and the hypertension, and even more so because it's hard to really communicate with them. They shouldn't be eating all that. They need to exercise. You see what I'm saying?
Right.
And so they're more prone with our unhealthy diets to develop these inflammatory illnesses.
Well, I think that's a really good point, because I mean we're kind of dialing it into inflammation,
Right.
And you said something that was really interesting just right now. You were talking about like the foods that we eat and working out, and fair enough. And I think I can laugh at myself. I mean, when you came in here, I mean, we haven't seen each other in a while, and you're like, man, you've lost some weight.
But you look great.
Yeah, right. You've lost some weight.
You're aging well.
Aging well. And, I swelled up, and I ended up, it took a whole entire year, but I did lose 83 pounds. And it was the heaviest that I've been, probably even heavier than you remember. But one of the things that was really interesting was, man, it was really hard to get into the cycle. And one of the things that was really frustrating was, so I did do this with two other guys, and we were keeping each other accountable. But man, they were always way ahead of me. They were like leaving Charles in the dust. I was getting left in the dust. I'd see the text. Oh man, I just lost, blah 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 weight, blah 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 weight. I'm like, what's going on? But here was the interesting thing, is that the discipline for me paid off. So those times, we did it with keto, and we didn't work out a whole lot because we were just focusing on the diet. But what's interesting is when they would do travel or they would do special occasions, holidays, they'd get off of it. I didn't. I stayed on it because I was just diligent about that. And it was interesting because I just knew at that very moment that I was going to win. And by the end of it, I was way ahead of them. I'm talking like 25 pounds ahead of them, right? Which was huge. But I could see how it was so easy to get disrupted because it did take a while to kind of get started. So this does take a while, right? You can't expect like instantaneous results. I mean, in your opinion, again, everybody's going to be different. What's the process where you start to see some change when you're making some of these life change choices?
When people are first motivated and disciplined, and you're very disciplined, men respond really quickly.
Okay.
And I see it a lot. Sometimes their wives get discouraged and things like that.
Right.
But I've seen women do really well in a short period of time, 6 months.
Okay.
I've seen men turn it around in 3 months. Those who are real dedicated to exercise and changing their diet and getting their sleep and reading and learning and taking it serious, they can turn it around pretty quickly. But what I see most is that long-term change of life routine that makes a difference, like what you're saying. And if I can ever get them to say, hey, this is going to be how I live the rest of my life. This is not going to be until I hit my target. Because most people get their target weight, and what do? They celebrate. What do? They overeat. They do things they shouldn't do. Yeah. And before you know it, they already did what? Broke the ice and started heading the other way. And I tell them, I said, look, if you do stumble, that's okay. If you eat 80% of the time healthy, that's what you should do anyway. You can have a cheat day. You can do things that fall off your diet. What I try to encourage people to do, especially to stay disciplined, is that when you're around your friends, don't try to stay on your strict diet because they're going to give you a hard time. Right. Just make sure you get back on it when they're not around. And I've told people that when I get around my family and friends, I say, how you see me eat now is not how I eat when you're not around. Okay? Because what happens now, you got the peer pressure. Come on, have this. Oh, why aren't you having this? Why are you on a diet right now? You're hanging out with your friends. So it's best to don't even let them start that routine with you. Just enjoy yourself and then get back on your diet or your routine the following day.
Yeah. Well, what's funny is I actually believe that they're just like looking at you going, I should be doing that. And since I'm not, I'm going to give you a hard time because if I can get you to fall, then I just feel better about myself.
Yeah,
I'm just saying, right?
Misery loves company.
That's interesting. Yeah. So we do talk about alcohol, and obviously, that's in our society. I've noticed that younger people have kind of been shying away from it, which I think is a pretty good thing. But as it comes to like inflammation and weight loss and gut brain health, I see you shaking your head already. So, I'm sure some of the moderate drinkers out there, or maybe the slightly non-moderate drinkers out there might probably want to understand like what happens when you drink as it relates to your gut and your brain.
Well, I'll start off and say this. Alcohol is a poison. Okay. It's a toxin. It's an inflaming agent. Okay. You can destroy nerves with alcohol. Okay. In fact, as a pain management doctor, there's certain procedures you can do that you can go ahead and ablate the nerves and use alcohol to do it. You might use phenol or something like that, but it's still an alcohol. Okay. Alcohol destroys brain cells. Okay. And if you want to get really deep into it, look at Dr. Daniel Amen. He said you should never have one drink. So I've been taking my brain health a lot more seriously lately. And one of the things I said, you know what, I don't need to drink. So I don't drink very much. Okay. I might have 4 or 5 drinks a year now. Okay. I never drink heavily anyway, so I don't want people to think it. But I'm just saying now I'm at the point of, no, I don't need that. Give me water. And I'm not ashamed. I don't care what people think of it or anything like that. I probably had maybe 3 drinks this year. Wow. And I just don't. I don't need it. And I think because as I'm getting older, as you mentioned, I'm 66 years old, and I think I want to preserve my brain. There was a conference I went to about 3 years ago. They said one of the things they're concerned about as we live longer are people's brain going to keep up with their age. No, it's not. Because what is happening, people are going to live to 80, but their brain is not there with them anymore. Okay. There's a huge problem with Alzheimer's disease in women. And it's because a lot of it's hormone related, but I think it's also tox related and other things going on too. And there's a huge problem in Parkinson's in men. There's higher incidence of Parkinson's in men compared to women, and the opposite for Alzheimer's women to men. They think that Alzheimer's is related to estrogen levels. Women's estrogen levels drop precipitously after menopause. And they think Parkinson's is just exposure, toxin exposure, like glyphosate and things like that
Interesting.
for men.
So basically, I mean, I think a lot of what I talk about on the show too is about just small steps, right? Like
Right.
there's probably not one thing that's going to solve all the problems,
No, it's not.
right?
Mm-mm.
But you have to be very diligent about this. So like you said, you drank alcohol, but you had 3 drinks last year. You're very aware that, that is not probably going to be good for you, long term, even at any level. I mean, 3's, pretty mild in my opinion. That's not a whole lot. But we're going back to even your diet, your exercise, all that aspect of it. So, I mean, it sounds like when we say it out loud, I think it sounds pretty simple. It sounds like the formula is simple. I mean, there's some technical, and there's some medical aspects of it. But what I'm hearing you say is that it is simple if you just categorize it. But then it's the part that's not so simple is finding the time or making the time. Let's not say finding the time, because people have time, right, in some aspects, but making the time to like do these lifestyle changes and then kind of have the discipline to kind of stick with it.
Yes.
But I mean, I don't know. It just seems like there's a lot of people that are sick. I mean, we meet a lot of folks that are not. And when I say sick, I mean, some are like, varying levels, but I mean, I'm sure you see a lot of this too. I mean,
I do.
you might be treating people on a lower level and a more intense level. I mean, what
Well,
are you
we're a nation
seeing
of
out there?
chronic disease.
Okay.
And the thing is, functional medicine attracts people with chronic illness
Okay.
because guess what? The traditional doctors have nothing for it. If you
Okay.
have a chronic illness, you're on meds already.
Right.
So if you want to get well, the doctor who's a medical doctor does not practice wellness, does not practice functional medicine. It's like going to McDonald's for a steak. So if you want to get healthy, you got to go to people who practice health care, not
Right.
medical care.
Right.
And so that's the beauty of functional medicine. What you're trying to do is take somebody who is dysfunctioning and make them functional again. And it really starts at the mitochondrial level. And all the years I've been practicing now for 40 years, we just had our 40th reunion a couple
Wow.
weekends ago. And for the first 30 years or so, never talked about the mitochondria. I never
Really?
used terms like redox. No, that is not a concept in medical care.
Interesting.
And I remember a few years ago, it's like they were challenged, medical doctors were challenged that there's mitochondrial diseases. There's a lot of, pretty much all diseases are mitochondria related because
Okay.
the mitochondria is the powerhouse of the cell. If the mitochondria goes, the cell dies. I don't care what cell it is. Death of the cells in your brain is not good. In your heart is not good. And each of these cells have different lifespans. I was reading probably a few months ago that said the heart cells have to last about 40 years. They don't turn over. Liver cells turn over about 17 years. Skin cells maybe every 2 weeks to a month. When you're younger, they turn over more. Lifespan of red blood cells are short. But so here we are, not being concerned about our cells. And see, and what controls whether a cell goes into what we call autophagy, cell death, is the mitochondria. It takes energy to determine.
Okay.
You see, is this cell viable or should this cell be put to death? And so what happens is that as you get older, you get more senescent cells. Why is that? Because as we get older, our mitochondria doesn't function as well, and we have less mitochondria in the cells. And that's a big problem. So when I look at it, it's all about the mitochondria. It's all about energy. What is happening at the mitochondrial level? These drugs that we're given, why are they toxic? Because they're toxic to the mitochondria. When I start telling people to take vitamins and minerals and hormones and giving them oxygen and things like that and tell them to do water, all that benefits the mitochondria. But when you start talking about EMF and you're talking about statin drugs and you're talking about even stuff like Tylenol, what are you doing? You're attacking the mitochondria. So it really is all about the mitochondria. You need energy to be well. When you don't have energy, not only you're fatigued, but you increase your risk of illness and death. That's the problem.
That's interesting because it sounds like the way that you're describing it is we're working against ourselves.
Yeah, we are.
We're just working against ourselves.
Yes.
And the natural thing is, let's just, logically, when you get older, right? I mean, the most cells that we have in our body are when we were born, right? So as we age and we get older and older, then we're going to have less to work with. So you're saying if we're like working against ourselves, then we're going to even have less than that to work with.
I'm not saying that your liver can't make new cells, your brain can't make new
Right.
cells.
Okay.
Because there's neuroplasticity. But the turnover is not as great as, say, the skin cells. That's what I'm trying to say.
Okay.
Because we have stem cells that will make new cells.
Okay.
Okay. But why, as we get older, you start seeing heart disease? Like I just went to a lecture, Dr. Sandhu and Dr. Singh had done it. It was on atrial fibrillation. And they were talking about, how to diagnose it, of course, when to intervene and what procedures to do. And I intervened by saying, okay, yeah, I understand all that, but where is all this coming from? Yes, as people live longer, they have an increased risk of atrial fibrillation, but it's an inflammatory illness. They said, yes. And I said, if you can delay it or even try to prevent it and reverse it by what? Make sure you have proper nutrients and minerals and hormones and oxygen. They said, yeah, you're right. Selenium is critical to keep a heart healthy. And so we aren't doing enough of that. We aren't focused on how to stay healthy. But here's the problem. You have to motivate somebody to want to be well.
Right.
See, I'm never concerned about having patients. The only thing is I don't want any patient. I want those who want to be well because those are the ones who are going to be motivated to be well.
Right.
And so the numbers are very minuscule of those. If you encounter people and you tell them, are you really going to dive in and focus on being healthy this year? And that means cutting back on your alcohol. You're going to exercise. You're going to get proper sleep, take your minerals, your vitamins. You're going to go get properly tested, and you're going to stay on it for a whole year. A lot of people don't do that.
Right.
If you take 100 people, you might be fortunate to find 3 or 4 that will commit to that.
Well, 3 to 4%.
It's not going to be high. With me having over 400,000 people in Bakersfield now, right?
Yes. Yes.
And I said I need about 400 to have a nice, mature concierge practice for functional medicine.
Okay.
What percent is that? So 400,000, 40,000 is 10%. 4,000 is what I just gave up.
Right.
Is 1%. You're talking about 0.1%.
Yeah.
So it doesn't take a lot of people. So when people say, oh, you're not getting anybody to come see you for concierge, I'm like, well, those aren't the people I'm looking for. I'm looking for those who want to be well.
Right.
Okay.
Right.
And it's easy to find them.
No, that's really good to hear. And I think it's really important for us to talk about these things. And I think people need to go buy your book, right? Because I think this will give them a perspective of, what they need to do and, what they need to focus on. Because, you've got my mind going right now. Because, I think about, I consider myself, I was disciplined to lose that weight, but man, I fall short. I do. And I get what you're saying because it really is hard to be on all the time. But at the same time, I got to think of the bigger picture. And I think everybody else has to think of the bigger picture. And I think that's what you're saying. It's really hard for those to but I think if correct me if I'm wrong, but you're just saying that you just have to start somewhere.
Yeah, you have to start somewhere, and it's a lifestyle.
Yes.
If I haven't seen you, I looked at when the last time I saw you, so I'm not going to reveal that. But I will say that you look healthier now than then.
Right.
When I look at your skin, it's very hydrated. It's very youthful. It looks healthy. When I look for men, I always look at their belly. The belly tells all. The bigger the belly, the lower the T. And so you put in the work. I look at your muscle tone. Okay. I see your eyebrows are still there, because losing a third of your eyebrows could be a sign of thyroid disease.
Interesting.
So the thing now, there's some other things I would like to do. Put you on the theta scale. Look at your fat to muscle ratio.
Yes.
Look at your metabolic age. I would also like to scan you and look at what's going on intracellularly, so far as heavy metals and hormones and vitamins and minerals. You see, I would love to do a true hormone panel on you, involving tissue levels of hormone, not blood, because blood is a transportation for hormones. And look at your urine levels for hormones. Look at the metabolites of the hormones. So I had a good idea. That's a basic way I start with a patient. Once you do that, you know where they are. Right. I say probably 2% of the patients walk in my office healthy.
2%?
Healthy.
So 2% out of the 3%.
And all I do is just help them maintain it.
Okay.
2%.
Wow.
I would say probably about 5-10% are in good shape.
Okay.
I love to grade people with their health. I'll say 2% come in A+.
Okay.
Probably 5% come A minus, B plus, but most people are average. They come in, I get some D and F type patients with their health, but most people, they say, hey, doc, I finally decided I want to get healthy. And I've heard of you, have friends come to see you, I read your book or something. I saw you on social media, and I just want to see where I'm at. And then I go with them. And then what happens, they get healthy, they say, wow, there's always something to do. If you're not healthy, this is the thing. When I see a new patient, I always look, if you're healthy, I'm trying to find out where you're not.
Right.
And if you're not healthy, I try to see where you are. There's some things, everyone's doing something right. Because they're still alive. They're not dead.
Yes. Okay. Well, that's a good thing.
Okay.
All right.
So I try to
that's a
encourage
good way
those.
to start. Yeah.
Yeah, I try to encourage those who aren't doing well, that they're not as bad as they think. But I also try to let the people who say, hey, I'm good, I don't need any help. No, there's a couple of things I need to see. And if nothing else, I need to monitor you at least.
Right. No, that's amazing. So how do people find you, Dr. Beatty?
Well, I'm here in Bakersfield, California. My office address is 6001 Truxton Avenue. And I have my phone number there is 661-395-013. I have an Instagram page, Doc and Back, DOCNBAK. And I have a YouTube channel right now. It's Limitless Longevity.
Okay. Limitless Longevity.
Limitless Longevity.
And then how about TikTok? I've seen you on TikTok.
Yeah, TikTok is Short Knocker.
Short knocker.
Yeah, the reason is I play golf, and my friends tease me, call him a short knocker, because I don't hit it as long as them.
Oh, I see how it is.
Instead of using it as a euphemism that upset me, I turn it around for something positive. So I'm a short knocker.
You know what? That is really, really great. I just did the last episode on it's either the glass being half full or half empty. So that was a half full moment for you.
Yeah, it was.
That's awesome. And then again, where can they get your book?
It's on Amazon Books as well as Barnes & Nobles. And an audio version will be coming out real soon.
That's great. That's great. Well, Dr. Beatty, this has been informative, and I really appreciate being able to catch up. And I think there was a lot of great things in this episode that people can glean from. But, yeah, I highly encourage people to get the book, look up Dr. Beatty, reach out to him. I'm sure there's a lot of things that we can all learn. And I truly believe that. And I think, this is important. I mean, we have a real issue here that we're dealing with, and health is important. You want to be the best. You want to be the best for your family. You want to be able to perform your best. And this is an opportunity to really just focus on, some of the important things, but we just got to start. So if you know someone who would benefit from watching this episode, share it with them. We'd love to see some comments. I mean, comments are great. Like, I'd like to hear, whatever you guys are thinking. I mean, just put it out there. Let's start a conversation. If you have time, you're feeling generous, appreciate if you rate the show. That really helps us out. We're trying to grow the channel. You can find us on YouTube at Hey Charles Biz, Hey Charles 77 on Instagram and TikTok, Hey Charles on Apple Podcast and Spotify, and Charles Ernst on LinkedIn. See you next time.